MHA is a fast-growing UK-wide association of some of the best accountancy practices within the UK. We currently have 9 member firms. Within those firms there are 42 officers, 168 partners and nearly 1,500 staff, so full national coverage. Our specialist healthcare teams have acted for the medical profession for many years in all aspects of their working lives. Our clientele include general practitioners, locums, hospital doctors and consultants, dentists, care homes, and all of their wide and varied different business associations. We also have very specialist in-house teams that can work with social enterprise clients, and that will become more and more important as we work through the new reforms, setting up new structures of businesses in that regard. Traditional accountancy practices will look at accounts, bookkeeping, general tax advice. MHA will differentiate ourselves from those practices by offering a more bespoke and specialised service to our healthcare clients. With our national network of local offices, we can provide that personal service. Patients and list size payments based on capitation will become the cornerstone of general practice going forward, and therefore it is vital for practices to maintain and even increase their patient numbers over time. One way of potentially doing this is to commission services from the CCG for activities that they don't currently do, which will bring patients to their practices for those services. By providing these services, it may then lead the patients to enlist with the practices for their core services as well, therefore increasing list size and practice payments. VAT is another area which should be considered. In general, the medical profession is exempt from VAT, and indeed, in regard to practice-based commissioning payments, HMRC have stated that these are outside the scope of VAT. However, with clinical commissioning groups and larger tenders potentially coming to the table, practices and their associated businesses need to be very careful of the VAT position of any tender that they put in, and specialist advice should be sought. General practice at the moment is going through a period of change with the new NHS bill, clinical commissioning groups, potentially new structures being developed. They will need more and more specialist advice, and MHA is available to provide that to them.
MHA considers that when general practice looks at clinical commissioning groups, there are 2 aspects to it. There's, first of all, many practices will perceive it as a threat, and there are threats. What we have to think about is what those might be. The first one, we think, is the threat of competition. The second one is the threat that actually practice income through the core contract could be reduced. Nevertheless, we also need to consider the opportunities that CCGs will present. Once they are able to start commissioning work from doctors' practices, then I think doctors' practices will need to get used to dealing with looking at the bigger scale. It is actually going to potentially improve patient care and will keep the GP at the centre of continuity of care. One model that we think will become increasingly prevalent is where practices will start to come together to form federations of practices, and by this they will be able to tender for bigger work that they would not otherwise be able to undertake, and more importantly, be able to spread their costs over a wider base. However, if we are moving into this area, it is an area which will need specialist advice. Where practices are taking work into the practice, then we need to consider the effect on Nhs reimbursements. A very clear problem is that where there is non-NHS work, this could have an effect on practice reimbursements. Abatements could easily happen, and where we do get an abatement, the extra income might not be commensurate with the actual income that is being produced by those extraneous activities. That is something that needs clear planning. MHA is able to provide that planning. There are a multitude of different structures that we need to consider. The first thing is, where we are moving into larger multidisciplinary team commissioning, then not only will the rewards be potentially larger, but the risks that the practice are entering into will be commensurately larger. Therefore, we will need to consider very carefully what structures should be adopted. Structures which could be adopted will range from structures that doctors will be very conversant with today. The Partnership Act 1890 structure is one which most practices will have adopted for generations. However, is this the right structure to adopt with unlimited liability going into the future? The NHS has made it very clear that commissioning bodies will be allowed to fail, and therefore I would not want to be undertaking commissioning through an unlimited liability entity. So what is available? We could go for a pure commercial structure, a limited liability company. The trouble is, profit-making structures will not be attractive to the commissioning bodies, because if they over-commission, then there's the danger that the profitability will be sucked out from the community. What we should possibly be looking at is social enterprises of some shape or form. MHA is adept at taking practices out on what we call business strategy days. That's where the practice gets the opportunity to sit down and spend some time together thinking about not where they need to be tomorrow, but where they need to be in 5 years' time, so that a plan can be put together to achieve that. That means, therefore, that as they are starting to think about this opportunity of maybe looking at multidisciplinary teams, that they look beyond just the medical side of things.
We are committed to helping our clients in this sector going forward, and whilst the new reforms will clearly raise issues, these are issues which we can help our clients deal with. More than issues, there are multiple opportunities which our clients need to be aware of, acting upon, and with our help, moving forward in their businesses.